Chapter 9, Pre-examination, Pre-analytical complications causing medical errors in blood collection. In this chapter, we're going to describe the pre-analytical complications related to phlebotomy procedures and an impact on patient safety, explain how to prevent and handle complications in blood collection, list at least 5 factors about the patient's physical disposition or makeup that can affect blood collection, list examples of substances that could interfere in clinical analysis of blood constitutes, describe how allergies, mastectomy, edema, and thrombus can affect blood collection. We're going to list the pre-analytical complications that could arise from test requests and identification, describe complications associated with tourniquet pressure and fist pumping, identify how the pre-analytical factors of syncope, petechiae, neurological complications, hemoconcentration, hemolysis, and IV therapy affect blood collection, and describe methods used to prevent these interferences. So variables important in specimen collection. So we're going to do a patient assessment and physical disposition. And that patient assessment is important in the specimen collection. It lets us know various variables. There is controlled and uncontrolled variables that we will look at in this chapter. We're also going to look at categories of specimen collection and transport and specimen receipt in the laboratory and test requests. So controllable variables, these are psychological variables, or physiological variables, and specimen collection variables. So these are things that the patient would have control over. So for example, if they were supposed to adhere to a specific diet restriction, if they were supposed to come into our lab and abstain from smoking or consumption of certain medications. Uncontrollable variables are biological influences, environmental influences, and underlying medical conditions. So this would be, the age and sex of our patient, the patient's geographical location, stress, fever. Those are things that are uncontrollable. The other thing that's part of the controllable would be the posture of our patient, the travel, lifestyle, exercise, diet, and also if they have had prolonged bed rest. So basal state. This is early morning, approximately 12 hours after the last ingestion of food. The specimen is the most reliable for testing. Abstaining from water can result in a patient's dehydration and can impact the real basal state laboratory values for patients, so the required time period necessary for abstaining is 8 to 12 hours before collecting the sample. After 12 hours, it can lead to erroneous results since normal laboratory results are based on the 8 to 12-hour fast. So diet, exercise, emotional stress, obesity, menstrual cycle, pregnancy, diurnal variations, posture, tourniquet application, chemical constitutes can cause changes in our basal state. So inadequate patient instructions can cause mistakes in specimen collection. So we want to make sure to be very detailed and thorough. If the patient is not fasting, we need to indicate non-fast on the requisition, insert it into the computer notes, and directly on the specimen to notify our lab. So diet, the term fasting refers to absence from nutritional support such as food and beverages except for water. Required time period necessary for abstaining usually is 8 to 12 hours. And like I had stated before, if it's longer beyond the 12 hours, this could impact our test results. Before collecting a specimen, the healthcare worker should ask the patient if they've had anything to eat or drink and then confirm how long ago. So we would ask the patient, have you been fasting today? If so, when's the last time you had something to eat or drink to confirm it has been a 8 to 12 hour fast? Please make sure to read the clinical alert on page 290. So the diet, the blood composition significantly is altered after meals and consequently unsuitable for many clinical chemistry tests. The patient has eaten recently and the physician still needs the test. The word non-fasting must be included on the requisition or directly on the sample itself. Please be aware that coffee, chewing gum, and tea should be avoided because these can cause fluctuations in the patient's blood sugar levels. If the healthcare worker has to explain fasting restrictions to a patient, instructions should be thorough and clear with an emphasis on important points of the procedure, as well as a written copy for the patient to refer to. Turbide or lipemic serum. If a patient has recently eaten fatty substances, he or she may have a temporary elevated lipid level, and the serum will appear lipemic or cloudy as shown here. This is what a normal sample looks like. The serum is yellow. Turbide would be a milky cloudy appearance as shown here, or even like a butter-like appearance. Because lipemic serum does not represent a basal state and may indicate some chemical abnormalities, documentation about the appearance of the serum may be useful for the physician. Please be aware this can be caused primarily by ingestion of fatty substances such as meat, butter, cream, and cheese, and/or occur when the lipid supplement is included in the vitamins the patient is taking. Also, too, if we notice this in our lab, it might, like said, might be useful to document to provide to the physician as well. Obesity. Obese patients generally have veins difficult to visualize or palpate. Not always. Please be aware that referring back to Chapter 10 to view examples of different arm veins. In situations like this, as a vein is not assessed when first punctured, the healthcare worker must be careful not to probe excessively with the needle, because this could rupture the red blood cells, increasing the concentration of intracellular contents and release some tissue factors into our sample. Therefore, our sample would be inaccurate. So please be aware there are longer needles available for collection from obese patients. Preanalytical variables damage occluded, sclerosed veins or obstructed or occluded veins do not allow for blood flow through them. Sclerosed or hardened veins are a result of inflammation, disease, and the veins that are repeatedly punctured often become scarred and feel hard when palpated. So please be aware that veins that have been repeatedly punctured and scarred, we want to avoid those sites at all costs according to CLSI. The veins that are sclerosed are going to be hard or feel like a cord. They're not going to be bouncy like a rubber band, like a traditional vein. Thrombos. Thrombi are solid masses derived from blood constituents that resides in the blood vessels. A thrombus may partially or fully occlude a vein or an artery, and such occlusion will make venipuncture very difficult. So please be aware that this is what it would look like. And it can occlude the vein, it can partially block the vein as well. Patient would be very protective of this arm. Allergies. Allergic reactions due to exposure to antiseptics, adhesives, and latex products occasionally occur in patients. So it's really important to check for color-coded armbands or posted signs indicating specific patient allergies. Hexidine is used as an alternate to decontaminate the skin, and the latex-free tourniquets, gloves, and bandages are recommended. It is also, we want to be mindful of many patients are allergic to stickiness in the adhesives used in a variety of bandages and experience itchy rashes after exposure to these bandages. To avoid this possible adhesive allergic reaction in patients, having blood collection, the healthcare provider can fold a gauze square over the venipuncture site with a self-adhesive bandaging material such as Coban or Coflax. Please be aware of the clinical alert on 291 as well. Exercise, short-term effect versus long-term. In general, moderate or excessive exercise has an effect on the laboratory test results, but it's up to the physician to interpret their effects. Exercise has an effect on our homeostasis. So please be aware many studies about the effects of exercise are inconclusive. But in general, moderate or excessive exercise has an effect on laboratory test results, but again, it is up to the physician to interpret these. Stress is part of our pre-analytical errors. Stress, emotional stress can cause a translucent elevation in the white blood cell count. Patients that are often frightened, nervous, or overly anxious, especially prior to blood collection, these emotions can then cause a lot of variation in our lab results, as shown here. It can cause a transition decrease in serum iron levels, abnormal hormone, cortisol, aldosterone, renin, thyroid stimulating hormone, and prolactin levels. It is also really important to understand that anxiety can result in hyperventilation, and due to this can cause an acid-base imbalance, increase lactate levels, and increase fatty acid levels. In one report, newborns have been crying violently, had their white blood cell counts elevated by 140% after resting baseline counts. Even mild crying was shown to increase the white blood cells by 113%. So it is suggested that in this circumstance, we allow patients to, the patients to calm down before we continue with the procedure. Stress, again, anxiety can increase blood constitutes of albumin, fibrinogen, glucose, cholesterol, and insulin. Hyperventilation, again, can cause that acid-base imbalance, increase lactate levels, and increase fatty acid levels as well. The dural or circadian rhythms and posture. The body's fluid fluctuates during the day, causes some hormone levels to change depending on the time of day. Collecting specimens during the designated time periods, are important for proper clinical evaluation. So it's also how the body releases melatonin, anti-inflammatories, and antioxidants as well.